posters that show them what you're all about, and vinyl banners that let everyone know you arrived. No matter what you need, we print all the signs that you can put here, so you stand out.
To the October 28th, 2024 Haldeman Norfolk Health and Social Services Advisory Committee meeting. I would like to remind everyone that our meetings are web streamed. With that, I call the October 28th, 2024 Haldeman Norfolk Health and Social Services Advisory Committee meeting to order. First of all, I'd like to ask, are there any disclosures of pecuniary interest? Seeing none, what I'm going to do is move these chair notes over to the chair, and that would be perfect. I'll just give you a minute. Thank you.
Good morning. Thank you for that. Are there any additions to the agenda this morning? Seeing none, we'll move on to adoption, correction of advisory committee meeting minutes 3.1. Health and Social Services Advisory Committee, September the 23rd, 2024. May I have a motion to approve the Haldeman Norfolk Health and Social Services Advisory Committee meeting minutes from September the 23rd, 2024. Mover and a seconder, please. Moved by Member Duthie, and seconded by Member Metcalf. All in favor? You're good, Member Van Pasten? Oh, thank you. Thank you very much. This motion is carried. Thank you. Update on any reports. Sarah?
Thank you, Madam Chair. Nothing to update at this time.
Thank you. Staff reports, 5.1 Public Health Respiratory Season 2024-25, HSS 24-050. Director of Public Health.
Good morning and thank you,
Thank
Madam
you.
Chair. Through you, I would like to introduce Sarah Titmus, Program Manager for Infectious Diseases, to present this report. Thank you.
Good morning, everybody. Through you, Madam Chair, to the Advisory Committee. During the late fall and into the winter months, respiratory viruses, including influenza A and B, COVID-19 and RSV, increased significantly, with a peak of these cases during November and April. Anyone can get a respiratory virus, with some people being at higher risk of severe illness, including the elderly, immunocompromised people, pregnant people, folks from equity-deserving groups, healthcare providers, and unvaccinated people. HNHU's surveillance monitoring of disease trends suggests that, similar to last year, we will experience a high level of respiratory illness and institutional outbreaks than pre-COVID levels. We also saw an earlier start to respiratory season, with reports of influenza outbreaks in our institutions late August to early September 2024. For the last reporting week, local data demonstrates a moderate risk level for respiratory viruses, with this trend currently remaining stable. Protecting Haldeman and Norfolk residents from infectious diseases is a cornerstone of HNHU's programming and includes a multifaceted approach aimed at reducing transmission. HNHU uses epidemiology to identify ways of decreasing respiratory viruses and provides health education, vaccination, case contact, and outbreak management. So what can residents do to lower their risk of getting a respiratory virus? The main thing is to stay up to date with immunizations, including flu, COVID-19, and RSV if eligible. Vaccine is the most effective way to decrease the severe side effects and outcomes from respiratory viruses. Vaccination for respiratory viruses is also best used in a multi-layered approach that includes washing your hands frequently and avoiding touching your nose, ears, and mouth, practicing respiratory etiquette, coughing or sneezing into your upper sleeve, staying home from work or school when you or your child are sick, cleaning regularly high-touch surfaces at home and at work, and considering wearing a tight-fitting medical mask in indoor public settings, especially if you are at high risk of severe infection. Thank you. I'll open it up to questions.
Are there any questions for this report? Seeing none, I'll ask for a motion to accept the report as information. Moved by Member Van Riesche, seconded Member Van Passen. Thank you. All in favor? This motion is carried. Thank you. Move on to 5.1.2, Strategic Plan Action Plan, HSS 24048. The report is being introduced by Saeed Shaha. Thank you.
Thank you, Madam Chair. Through you, I would like to introduce Julie Richardson, Health Planner, to present this report. Thank you.
Good morning. I will just be providing a brief overview of Report HSS 24-048 on our Strategic Plan Action Plan. In April of this year, the Health Unit Strategic Plan was presented to and approved by Board of Health. And since that time, we worked to engage Health Unit staff and review best practices to inform the development of an action plan that will guide the Health Unit to carry out our strategic plan. The action plan is an operational document that informs the steps that staff will take, the timelines, the required resources, and the monitoring and performance measures. The action plan is flexible to allow the Health Unit to respond to the changing needs of the organization and to capitalize on new opportunities arise while still working to address the strategic priorities and objectives. In the report today, you will find tables that show the objectives and the activities for each of the 4 strategic priorities. And the implementation of this work has already begun, with many projects already underway and will continue over the next 3 years. Annual progress updates will be shared with the Board of Health. Thank you for your time.
Thank you for that. Is there any questions or comments for this report? Seeing none, may I have a motion to accept the report as information? A mover and a seconder, please. Moved by Member Van Riesche, seconded by Member Metcalf. All in favor? That's carried. Thank you. We'll move on to Communications 6.1, October Alpha Info Break. May I have a motion to accept item 6.1, September Alpha Info Break as information? May I have a mover and a seconder, please? Moved by Member Metcalf, seconded by Member Duthie. All in favor? That's carried. Thank you. Moving on to other businesses, is there any other business? Member Van Riesche?
Thank you, Madam Chair, and through you, my apologies. I just, on the last item of this strategic plan, if I can flip to it. Hang on a second, it's just here. Julie, is that correct? Julie? Okay. This is the report, the strategic plan itself. Have we seen the actual strategic plan?
Through the chair to you, yes, it has come to Board of Health. And it's available publicly on the website as well.
Okay, that's what I wanted to stress. It is available on the website, so any of the public can get on and take a wee peek to that. Perfect, thank you very much. I just wanted to make that public. Thank you.
Thank you. Is there any other business? Seeing none, we'll move on to the next meeting is Monday, November the 25th, 2024. An adjournment. May I have a mover to adjourn at 9:42. It's a Monday. 9:42 a.m., please. Moved by. Thank you. Member O'Neill, seconded by Member Metcalf. All in favor? This motion is carried. Thank you. The committee will move into a special Health and Social Services Advisory Committee meeting. Are we starting at 10:15, or can I amend that
Madam
now?
Chair. We cannot start till 10:15.
We cannot start till 10:15.
Correct. We do have refreshments for you.
Thank you very much.